Hi, Lenore here with Medicare plan discounts. Are you turning 65 and about to enroll in Medicare for the first time? If the answer is yes, then this message is for you. Stay tuned. In day 3 of our mini-series, Medicare, the Inside Scoop, I'm going to share with you what every boomer ought to know about the 2 ways to receive Medicare benefits, Medigap versus Medicare Advantage. Stay tuned. Today, I'm going to share with you what every boomer ought to know about the 2 ways to receive Medicare benefits, Medigap versus Medicare Advantage. Remember to visit us at MedicarePlanDiscounts.com and subscribe to our YouTube channel in the lower right corner. Also, feel free to like, comment, or share if you receive value from this video. So let's get started. What every boomer ought to know about receiving their Medicare benefits, Medigap versus Medicare Advantage. So basically there are 2 ways to get your Medicare benefits. Option 1 is having original Medicare Parts A and B with a Medigap or a Medicare supplemental plan along with a prescription drug plan. Option 2 is to pick up a Medicare Advantage plan, understanding that you still must be enrolled in Medicare Parts A and B with the Advantage plan. So let's take a look at the 2 different options so you could figure out which is the best for you. With both options, you need to be enrolled in Medicare Parts A and B. But with option 1, original Medicare, Medigap, and a prescription drug plan, Medicare is your primary insurance, meaning that if you go to the doctor or hospital, they bill Medicare first. Now, Medigap plans were designed to fill in the gaps of what Medicare does not cover. So that means that what Medicare doesn't cover, they send the excess to the gap plan, okay? And then in addition to Medicare Parts A and B and the supplement plan, you need to get a prescription drug plan with option 1. Now, if you choose option 2, which is the Medicare Advantage plan, you need to be enrolled in Medicare Parts A and B, but private insurance companies manage your health care, not Medicare, okay? So that means if you go to the doctor or hospital, they are billing the Medicare Advantage insurance company, not Medicare, like in option 1. And under this option, the Medicare Advantage plan, prescriptions are usually included in the plan. So how much do they cost? Well, let's look at the premium first. Under the first option, Medicare, Medigap, and prescription plan, you will pay a premium for Medicare Part B, you'll pay a premium for your Medicare supplement, and you'll pay a monthly premium for your prescription drug plan, okay? Under the second option, which is Medicare Advantage, you'll still pay your monthly premium for Medicare Part B, but you will only have a premium for the Medicare Advantage plan. Now, Medicare Advantage plans typically have very low premiums. Some of them, in fact, can have a 0 premium associated with them. Now, the cost difference really is not only just the premium, but it's when you actually go to the doctor, or if you are hospitalized, you need some surgery or any kind of medical testing. This is another way that you have to compare cost. With option 1, which is original Medicare, a Medigap plan, and a prescription drug plan, you have very little out-of-pocket cost sharing. Most of your expense is in the form of a monthly premium. So there's usually no surprises with original Medicare, Medigap, and a prescription drug plan, because you're just paying your monthly premium. Medicare is your primary. What they don't cover, the secondary coverage or the Medigap plan, is designed to pick up the excess. With a Medicare Advantage plan, you are paying a lower monthly premium than a Medigap plan. However, you will typically see more expense in the form of cost sharing. So when you go to the doctor, you'll have a copay. Sometimes that's $10, sometimes it's $50 for specialists, depends upon the company and the type of plan you choose. There are deductibles and coinsurance with Medicare Advantage plans. If you have to be hospitalized or you're going for some type of surgery, you can expect to pay a copay every day that you're in the hospital, and that can add up. So with a Medicare Advantage plan, you may have out-of-pocket cost sharing as high as $6,700 in a plan year. Okay, so the other thing you need to think about with the two options is, can I go to my own doctor? Can I go to my own hospital? What if I travel? What if I'm in another state? How does that affect me? Well, with option one, Medicare, Medigap, and a prescription drug plan, Medicare is your primary. 9 out of 10 doctors accept Medicare. Most hospitals accept Medicare. You do not have to worry about networks or referrals, and you can use the plan anywhere in the United States as long as a doctor hospital facility accepts Medicare. You're good to go. With a Medicare Advantage plan, these plans are typically HMOs and PPO plan designs. They're geographic in scope, and that means that you may need referrals, and you do have to worry about networks, and you may need some pre-authorization for medical procedures. So let's take a little bit deeper dive into the two options. Option one, as I said before, is having Medicare as your primary, a Medigap plan picking up the excess or supplementing traditional Medicare, and having a traditional prescription drug plan. Now, under original Medicare, regardless of how you choose your coverage, you need to understand that original Medicare doesn't cover everything. Medicare Part A is hospital, usually you pay no premium. Medicare Part B is your medical coverage. There's $134 a month premium in 2017. If you're a higher income earner, you're going to pay more. You can refer to Medicare.gov or the Medicare and You booklet to see where you fall as far as your premium is concerned. Under traditional Medicare, there is cost sharing, including coinsurance, deductibles, and there's no out-of-pocket maximums. It's unlimited, so you could have a lot of expenses under traditional Medicare. That's why most people have to choose a Medigap or a Medicare Advantage plan with traditional Medicare, because they don't want to have to worry about these unlimited expenses that you could incur under traditional Medicare. Your cost sharing is typically about 20% under traditional Medicare. Now, with a traditional Medicare, you can use any doctor and hospital in the whole United States as long as they accept Medicare. So with option one, in addition to traditional Medicare, you're going to pick up a Medigap or Medicare supplement policy, because you don't want to have to worry about that 20% and cost to infinity with traditional Medicare. So Medigap policies are designed to cover the expenses that Medicare doesn't cover. They're purchased from Medicare-approved private insurance companies, and they can travel with you anywhere in the United States as long as the doctor accepts Medicare. Medicare is your primary. The secondary coverage or the gap coverage fills in the gaps, and the plans are standardized, so there's usually no surprises. There are 11 different plans you can choose from, and quite frankly, it's very easy to compare the different plans and options that are right for you. So, for instance, every plan G, which is one of the most popular plans, is exactly the same regardless of the carrier. Now, option one, in addition to original Medicare and a Medigap plan, you will have to pick up a prescription drug plan, because the Medigap plan does not cover prescription drugs. Now, there are usually about 20 different drug companies you can choose from in your area. They're Medicare approved companies, big name companies that you're familiar with. They cover brand name and generic drugs. They have a network of pharmacies that participate in the plan, and it really makes sense if you use a preferred pharmacy with the plan, so that way you're getting the best deal on your medications, and you will pay a monthly premium. The monthly average
prescription drug plan is about $35 a month. Some plans start lower, some plans are higher. If you're on more expensive medications, you'll probably need a more comprehensive drug plan, so you can expect to pay a little bit more if that's the case. So option number 2, the Medicare Advantage plan. A lot of people have been looking at these plans because they not only include your prescription drug coverage, but they also include benefits like vision, dental, and hearing. Some of the plans do. But you have to keep in mind that with a Medicare Advantage plan, you still have to be enrolled in Medicare Parts A and B, so you still pay your Part B premium, but your health insurance is being managed by the private insurance carrier, and Medicare is no longer your carrier for coverage. They outsource your coverage. So you typically are enrolled in an HMO, a PPO, or PCMH, which is a patient center plan, and they are geographic in nature. So if you travel a lot, this might not be a good option for you because the plans typically require you to stay within network. Now, the attractive parts to Advantage plans is that you'll pay a lower premium, and they may include some additional benefits like vision, dental, and hearing services, but the premiums can vary and the coverage levels can vary as well. So how do you really figure out which is the right option for you? You have to do your homework with this. This is not, a snap of the finger type of thing that you can just, okay, I decide on this. You have to compare the costs and the plans in your area. If you're looking at Medicare Advantage plans, you have to know what doctors and providers are in network. What happens if you're traveling and you go out of network? The thing about Medicare Advantage plans is that doctors and hospitals can come on and off the network at any time, so it's important to ask your doctor, ask the hospital if they are part of this network or group and how long they've been a part of it. The other thing is, if you decide to pick up a Medigap plan, Medigap plans are standardized as per Medicare, lettered A through M. There are 11 of them to choose from. So you're going to want to compare Medigap plans to figure out, okay, that might be a good option for me. How much do they cost? How much coverage level do I want? And which insurance company should I choose? So either way, you're going to be looking at insurance companies and costs with both those types of plans. If you choose the first option, which was Medicare, Medigap, you will need a prescription drug plan, and you'll want to compare those on Medicare.gov. Now that can get to be a little bit overwhelming. That's why we really recommend you speak to a professional, work with a broker, someone who has access to more than one plan design, more than one company, more than one prescription drug company, so they can help you navigate based on your personal situation. They will know the different plans available in your zip code. They will know how the supplemental plans are standardized, and they will know which carriers offer the best rates in your area. So there's an advantage to speaking with a professional. You won't pay extra. And then once you figure out which option is right for you, you can enroll in your plan. So what's next? Well, it's good that you have choices, but you also want to make sure that you're making an informed choice. So stay tuned for our next video, The Truth About Medigap Plans, What the Big Insurance Companies Don't Want You to Know. If you have questions, we'd love to hear from you. Give us a call at 844-280-0785. A licensed professional at Medicare Plan Discounts is waiting for your call. We can help you with your specific needs.
We've covered some great information today, information that will allow you to take one more step forward in understanding Medicare. I look forward to seeing you tomorrow on video number 4 in our series, Medicare the Inside Scoop, where we'll learn the truth about Medigap plans, what the big insurance companies don't want you to know. Remember to subscribe to our YouTube channel and visit us at MedicarePlanDiscounts.com. Also feel free to like, comment, and share this video with family and friends that could receive value.